Hello and welcome to Medical Dialogues. I'm Bhavika. Let's look at today's top news. UP urges NMC to permit MBBS admissions in 13 new medical institutes. After receiving a letter of disapproval from the National Medical Commission for 13 newly established medical colleges, the Uttar Pradesh government had requested the Apex Medical Commission to authorize the commencement of MBBS courses at these institutes for the 2024 and 2025 academic session. The UP government had planned to start admissions for 1300 MBBS seats across these 13 new government medical colleges. However, the NMC denied approval due to identified deficiencies in infrastructure and faculty strength during inspections. The affected medical colleges were located in Sultanpur, Kushinagar, Kausambhi, Kanpur, Dehat, Lalitpur, Pilibhit, Auraiya, Sonbhadra, Bulandshahr, Gonda, Bijnor, Chandoli and Lakhimpur Kheri districts. Alongside this, 58 other medical colleges across India also faced disapproval, with over 100 having applied for approval. According to reports, the UP government had appealed to the NMC to reconsider its decision for 2024-2025 academic session. If the NMC's decision remained unchanged after the appeal, the Medical Education Department of Uttar Pradesh was prepared to seek permission from the Union Health Ministry. Despite this, 3 private public partnership medical colleges were granted approval to admit 150 students each, and 2 government medical colleges in UP received approval to increase their MBBS seats by 50 and 100 respectively. Monsoon triggers rise in parasitic infection leading to leg swelling. During the monsoon season, there was a notable increase in vector-borne diseases, including climate-sensitive illness like dengue, malaria, and chikungunya. Lymphatic filariasis, also known as elephantiasis or hathi paw, was reported among vulnerable population. Lymphatic filariasis, a debilitating, neglected tropical disease, was caused by parasitic worms transmitted through mosquito bites. These parasites infected the lymphatic system, leading to severe and lifelong disabilities. In LF, swelling in the legs occurred due to disruption in the lymphatic system caused by the parasitic worms. The parasites lodged in the lymphatic vessel, blocking the normal flow of lymph fluid. Over time, this blockage led to an accumulation of lymph fluid, resulting in swelling of the affected tissues, a condition known as lymphedema. The swelling could become severe and often accompanied by thickening of the skin, which led to the characteristic symptoms of elephantiasis. India's allopathic doctor count hits 13,86,136, reports by Health Ministry. Recently, Union Minister of State for Health Srimati Anupriya Patel informed the Lok Sabha that India had a total of 13,86,136 registered allopathic doctors with state medical councils across the country. Additionally, the country had 38.49 lakh registered nursing personnel. Assuming 80% availability of allopathic doctors and including 5.65 lakh Ayush doctors, the current doctors population ratio in India was reported as 8.836 last year. Last year, former Union MOS Health Dr. Bharati Praveen Pawar had reported a doctor population ratio of 8.834 based on an 80% availability of 13,08,009 allopathic doctors and 5.65 lakh Ayush practitioners. Despite an increase in the number of allopathic doctors, the doctors' population ratio had slightly decreased according to the latest data. In response to a query by Agrawal, Srimati Patel was asked if the government had established any criteria for ensuring an adequate number of doctors to provide better healthcare services to every citizen and whether any schemes were in place to address the issue of healthcare facilities and personnel shortage in rural areas including Chhattisgarh. MOS Health reveals over 2,000 vacant positions in Delhi's central government hospitals. Last Friday, Union Minister of State for Health Anupriya Patel informed the Lok Sabha that over 2,000 sanctioned posts for doctors, nurses and paramedical staff were vacant in three major central government hospitals in Delhi: Safdarganj Hospital, Dr. Ram Manohar Lohia Hospital and Lady Hardinge Medical College and associated hospitals. Out of a total of 10,458 sanctioned posts, 2,079 were unfilled. Additionally, these three hospitals had a combined capacity of 5,929 beds. The ministry responded to inquiries by Shri Varun Chaudhary, who had asked for details on the number of beds available in the government hospitals for indoor patients over past 5 years. The current sanctioned strength and vacancies of medical staff and whether there were any proposals to enhance healthcare infrastructure according to WHO guidelines. In her response, MOS Patel stated that since public health and hospital fall under state jurisdiction, no such data is maintained centrally. However, she did provide information on the number of beds available at the central government hospitals in New Delhi over the past 5 years. Overheated non-stick pans linked to increase Teflon flu cases. Recently, there was a notable increase in cases of Teflon flu, a condition linked to non-stick cookware. According to the Washington Post, over 250 cases reported last year, marking highest number since 2000. They raised concerns about the safety of non-stick cookware and whether it might be contributing to the rise in cases. Teflon flu, also known as polymer fume fever, resulted from inhaling fumes produced by overheated non-stick pans. Non-stick cookware commonly contains PTFE, a material known for its durability and heat resistance. Although PTFE is generally safe under normal conditions, it can release toxic fumes when heated above 500 degrees Fahrenheit, leading to polymer fume fever. To prevent Teflon flu, it was crucial to use non-stick cookware at low to medium heat. High temperatures or prolonged heating increase the risk of harmful emissions. To minimize this risk, it was recommended to keep the surface temperature of non-stick pans below 450 degrees Fahrenheit. These precautions helped in reducing the likelihood of exposure to toxic fumes and associated health issues. Thank you for watching Medical Dialogues. Stay tuned for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.